A hearty good afternoon and welcome to a section on hypertension in pregnancy. We're glad to have Dr. Sujata Sharma among us today to help us understand this topic. Now, hypertension during pregnancy is seen often, but you must be aware of the risks that come with it. This may cause problems during pregnancy, uh, like keeping a stable blood pressure, helps reduce the extent of these complications. The good news is that high blood pressure can be managed if we focus on a healthier living and hypertension as well. So the doctor will take us through this process and more. Doctor, you have the stage.
Hi, good afternoon, everyone. Today I'll be talking about a very common condition during pregnancy, and that is hypertension, which develops during pregnancy. Now, at the outset, let me make it very clear that hypertension, which develops during pregnancy, is very much different from the hypertension which is there in non pregnant individuals, be it a male or a female. The causes and the consequences of both types of hypertensions, that means hypertension during pregnancy and hypertension otherwise, non-pregnant individuals, in both these cases the causes and the consequences are very different. So hypertension in pregnancy in general can be it can be divided into various categories. I'll not go into the details of those categories, but broadly what I need to tell you that hypertension which develops during pregnancy after 20th week. After 20th week means after mid-pregnancy, because 40 weeks is the total duration of pregnancy. So a hypertension which develops after 20th week of pregnancy and it goes beyond 140 by 90 millimeter of mercury and is recordable at the same levels, at heightened levels, on two different occasions which are 4 to 6 hours apart. That is what we label as hypertension during pregnancy. So this can be, we also call it gestational hypertension. So this is first category where the hypertension develops during pregnancy after the 20th week, and in individuals who have been normotensive, means who have been having normal blood pressure before pregnancy or even up to 20th week of pregnancy. Now these patients can remain only hypertensive during pregnancy, or they may progress to start having proteins leaking in the urine as well. And in that condition, if it is hypertension plus proteins both in the urine, then we call this condition as preeclampsia, and blood pressure is more than 140 by 90 millimeter of mercury. Second category of patients is where patients are already hypertensive. They are known hypertensive. They are hypertensive even before entering into pregnancy or before 20th week of pregnancy. These are the patients who are patients of essential hypertension or chronic hypertension, or this hypertension can be because of some kidney disease causing hypertension in a young individual. So this is second category of patients where it will be before 20th week of pregnancy. But once this hypertensive patient becomes pregnant and then after mid-pregnancy, there can be superimposed gestational hypertension. I mean the hypertension which develops due to pregnancy. So chronic hypertension in the beginning, patient entering with hypertension into pregnancy, and then there is superimposed pregnancy-induced hypertension, which can make the situation worse for the patient. Then third category of patients can be, supposing a patient comes to or goes to an obstetrician after for the first time after 20th week of pregnancy, and the obstetrician finds that she is hypertensive. Her blood pressure is more than 140 by 90 millimeter of mercury. So in that situation, and the patient doesn't give any history of hypertension, knowing that she has been hypertensive, but in that case, we are not very sure whether this is pregnancy-induced hypertension or patient is a case of essential hypertension or chronic hypertension. She had been not knowing about it. Maybe it was mild and she's not knowing about it, but has become more obvious now because she has been getting her regular antenatal checkups. So how to decide in these patients whether her pregnancy is pregnancy-induced hypertension or she is a case of essential or chronic hypertension? So normally what happens, this pregnancy-induced hypertension is of a short duration. Short duration means it's limited to the pregnancy, And once the pregnancy is over, there is complete resolution of blood pressure. The blood pressure comes back to normal levels within 6 or at the max up to 12 weeks post delivery. So if blood pressure settles post delivery, this was pregnancy induced hypertension. But in this category of patient, if she continues to remain hypertensive, that means the patient was already hypertensive when she entered into pregnancy. Or another probability could be you are a patient who had a tendency to develop hypertension because of some familiar reasons, genetic reasons, or whatever, and this pregnancy has now unmasked your hypertension, and this will not normalize beyond 12th week of pregnancy, and you may continue to require antihypertensive treatment later on also. Another category of hypertension is when the hypertension becomes very severe. It develops more complications, and patient then starts throwing convulsions, seizures. So that is the most serious form of hypertension during pregnancy. We call it eclampsia. Normally such a situation should not arise once a patient is having her regular antenatal, you are having your regular antenatal checkups. Such a situation will not arise because somewhere we have to put a stop to pregnancy in that situation so that the mother and the child both are okay. So why does this hypertension develop during pregnancy, right? Um, it- Despite the knowledge of hypertension, this condition since decades, I mean, there's no clear-cut answer till date why it happens. Although there's extreme research going on in this field, many things are being clarified over the time. But to pinpoint that this is the exact reason, still the theories are floating, and it could be because of some immunological reasons, it could be familial reasons, or it could be so many reasons which is beyond this talk. And what I would want to specify in this situation, that there are certain risk factors or the patients who are more susceptible to develop hypertension, so that if you have one of these risk factors, you become more conscious about it. Not conscious, not scary about it, but you become conscious or aware about it. And in case it does develop, a timely management will certainly help you to get a good outcome of this pregnancy. So these risk factors are, first and foremost, the first pregnancy itself is a risk factor. Primi gravida, we say that primi gravida, first time once you are pregnant. So why so? First pregnancy, in simple terms, is the test of immune status of a person. Just like you have a kidney, somebody has a kidney transplant, so it will depend upon if the immunological system of the patient accepts that kidney, that patient will be all right after a transplant. But if the system, his or her system, rejects that kidney, the kidney will be rejected. So same way, because 50% of contribution comes from the male. It's a sperm and the ovum 50-50, right? And sperm contribution or the male contribution is an external contribution to your family, to your body. And your pregnancy, your body adapts to this external external guest. Okay. So normally pregnancy or the body accepts this external contribution from the paternal side, and pregnancy goes on well, smooth, without any complications. But if there is some abnormal immunological reaction to this pregnancy, in that case a whole number of complications can develop during this pregnancy, and hypertension being one of them, right? So this is just one theory, and which appears to be more applicable to somebody who is pregnant for the first time and is developing hypertension. So first pregnancy itself is a risk factor. Another risk factor is obesity. So if BMI is more than 27, then that means that patient, that woman is more likely to develop hypertension. If there is a family history means that a mother had also hypertension in her pregnancies, or one of her siblings also had developed hypertension during her pregnancies. So in this kind of profile, again this woman will be more prone to develop hypertension during pregnancy. Only thing is not to be scared, but to keep a watch and to get regular antenatal checkups from your obstetrician. Then if twin pregnancy or multiple gestation, multiple pregnancy is there, again that puts the woman at more risk of hypertension. In case you have any medical disorder like you're diabetic, or you have some immunological disorder, or you have Rh negative, you are Rh negative and you're carrying a Rh positive pregnancy, and and then any medical disorder, molar pregnancy is another example. And so these are the conditions. If any one of you have these conditions, then you just have to be watchful for development, because in these type of women, the chances of hypertension are much more than somebody else who doesn't have these risk factors. So first thing for us to do is to screen the patients on the basis of these risk factors, and then subject to more frequent antenatal checkups. That's it. And at every antenatal checkup, what we need to do is a thorough examination and a regular check of your blood pressure, your weight, and certain other signs and symptoms which may indicate the developing hypertension, or if hypertension is there, then any worsening of the situation. So why is hypertension so important in pregnancy? Because this is associated with a host of complications. Host of complications. Complications can be both to the mother and to the fetus inside her womb. For the mother, hypertension can cause all those complications which are attributed to hypertension, and the most dreaded during pregnancy is the development of these seizures, and from mild hypertension to severe hypertension to the development of seizures. And this is what we aim to avoid that kind of a situation. So how do we divide what is mild hypertension, what are the limits of mild hypertension, what are the limits of and what is severe hypertension, and what are the signs and symptoms which will indicate that you are heading towards severe hypertension or some other complications. So normally blood pressure beyond 140 by 90 millimeter of mercury, but less than 160 by 110 millimeter of mercury, that is mild hypertension. And there are no other complicating signs. There are no other signs of severity of the disease. It's only this thing that you are having hypertension which is beyond 140 by 90 millimeter of mercury, and but less than 160 by 110 millimeter of mercury. Another thing which develops along with hypertension, though a little later, or may not develop at all in some of the individuals, and that is leakage of proteins in the urine, protein urea. So urine examination is done as a routine during pregnancy. So if proteins are more than 2 plus, 2 plus or more than that, that indicates this is abnormal protein urea. In that case, you need to contact your obstetrician will also inform you about the presence of this significant protein urea, and then some further tests can be done to monitor this protein urea. And then apart from protein urea, once this develops, the condition becomes preeclampsia. From simple hypertension, if protein urea is added, the condition will become preeclampsia. So what are then the signs of severity of the condition? Severe preeclampsia. That means blood pressure goes beyond 160 by 110 millimeter of mercury, right? And then the patient also, or you also complain, or you start feeling severe frontal headache, occipital headache right here, right? Or you start feeling black spots in front of your eyes, you feel the urine output is very low, or you have pain in the upper abdomen. So these are the conditions which should alert you that you need to consult your obstetrician immediately, and the doctor will also recognize this condition depending on your whatever you tell her, the signs and symptoms and the blood pressure readings. So what is the difference in the management between mild and the severe form of preeclampsia? In mild preeclampsia, as long as the blood pressure does not shoot beyond 150 by 100, you can carry on with your treatment from home. There's no need to admit you to the hospital, but you will require more frequent visits to the hospital. You will be required to keep a record of your blood pressure 3 4 times in a day. And for that, what you can do, you can have a notebook, and 4 times a day. The digital BP apparatus are available now, freely available in the market, and almost every household has it. So you can check your blood pressure 6 hourly, 4 times a day. And at any point of time, if you think your blood pressure is shooting beyond 150 by 100 millimeter of mercury, in that case you immediately need to inform your obstetrician, and the obstetrician will take care of whatever needs to be done for any investigations that need to be done for you, and the further monitoring, a more frequent monitoring, or whether you will require an admission for monitoring, that will be decided by your obstetrician. So we were talking about this severe preeclampsia. Severe preeclampsia, whenever it develops, blood pressure plus all those sign symptoms, headache, blurring of vision, less urine output, pain in the upper abdomen, immediately hospitalization now will be required. Hospitalization, and in the hospital a battery of tests will need to be done for this condition to keep a watch on your hematological parameters, means the blood pressure, the blood parameters. Various investigations need to be done for you, and you will the obstetrician will also have to keep a watch on your progress daily basis. So what complications can it cause? As we were talking earlier, then it can turn into severe hypertension, it can turn into seizures or eclampsia. Then patient can also have kidney knockdown, right? Patient can also develop pulmonary edema, fluid in the lungs, which is very, very common, not otherwise, but with patients who are severely hypertensive and are ignoring their hypertension, not bothered about their hypertension. One thing I just thought of telling you about hypertension, that when you are checking your blood pressure at home, right, up to 150 by 100, we generally do not like to give any antihypertensive. What we can suggest to you, you can take just extra bed rest. Don't stop your regular activities. You can continue with your regular activities, but just take extra bed rest. That means you can take 2 hours rest in the afternoon, or you can take 6 to 8 hours nap at the night, but it should be in the left position. In the left position, because when you are lying straight, the weight of the uterus presses upon our big blood vessels, vessels which are more towards our spine. So when these blood vessels are pressed, the flow to and from the heart is affected, and that affects your blood pressure further. So it's always advisable, hypertensive or non-hypertensive, the woman should lie preferably on the left lateral side when during pregnancy. Now, rest does not mean afternoon rest. I said take 2 hours rest during the afternoon hours. That doesn't mean that you necessarily have to sleep. You can just lie down, you can read a book, you can see TV, but just relax, and that too in left lateral position. And this helps to improve the reduce the blood pressure. This stabilizes the renal the blood flow to the kidneys. This also improves the blood flow to the uterus, and hence blood flow to the baby. The nutrition goes to the baby nicely, and this is how it helps. So some rest. So as I said, there's no need to restrict to your activities. If you are a working woman, you can continue to work. But if you are having a very stressful job, or you are having a job which requires you to stand for long hours, or very physical strenuous type of a job, in that case, that needs to be avoided. Certainly when patient is already having high blood pressure. Okay, so that kind of job needs to be switched over to some lighter job, but enjoy your pregnancy without any tension. But with regular checkups and with watch on yourself, your symptoms. Everyone will tell you, your obstetrician will tell you, well, okay, if you feel this, you report immediately to me. So apart from this severity of the hypertension, as I said, fluid in the lungs. If you start feeling difficulty in breathing, you are having lots of cough while lying down, and you feel more comfortable while sitting, the cough is less, the breathing is comfortable, or even if that is uncomfortable, that is the one sign which indicates that there is fluid collection in the lungs. It's a serious complications. Normally such complications should not arise if you are yourself very much vigilant about yourself, and if you are having regular antenatal checkups. But then there is no guarantee, this can develop suddenly. I don't say this will not develop suddenly, this can sometimes develop suddenly. And but the important thing is timely recognizing that you are having this problem, and then timely reporting to your obstetrician will avoid all these complications. Now I'm telling you all this not to scare you, but to make you aware of what can happen if somebody is hypertensive during pregnancy. Then I'm talking so much about hypertension. You may be thinking, is there no way we can know that this particular woman will head towards hypertension, will become hypertensive during pregnancy? Yes, certainly. There are certain predictive tests which can tell us the probability of development of hypertension in an individual. And these tests are available right from the first trimester. First trimester means the first 3 months of pregnancy. Pregnancy is divided into 3 trimesters of 3 months each, 9 months in total. Okay, so right from that, and one of the very important predictor is the blood is the ultrasound, and with color doppler. So there are certain which color doppler changes are very peculiar, which will predict that this particular person or this particular lady, it might develop hypertension during pregnancy. So every obstetrician is doing that kind of ultrasound with color doppler studies. Then there are certain blood tests also, certain and uh, so once this tendency is known, now the next question arises, is there any medicine which can prevent this? Now that we know a lady, based on certain tests, ultrasound tests or blood tests or urine tests, if a lady is prone to develop hypertension, are there certain drugs which can help to reduce the risk of hypertension, or it doesn't develop at all? um, as of now, there is not much evidence about the use of any drug which can prevent it. Yes, the role of low dose aspirin has been established in certain conditions. Not it will not help in every patient. It will help in patients those where there is a history of some immunological disorder in a woman, because this woman particularly will be more liable to develop hypertension. And so low dose aspirin starting as early as 12th week of pregnancy. 12th week means 3 months completed. So starting low dose aspirin 60 to 75 milligram daily, that will the dose will depend on your weight, because it has to be calculated as per your weight. So low dose aspirin starting from 12th week of pregnancy onwards, um, to some extent in certain category of women, this can help prevent the development of hypertension, or even if hypertension develops, it will be a manageable case. So once you develop hypertension, so what should you do, or what needs to be done by the doctor? Hypertension, as I said, up to 150 by 100 millimeter of mercury, blood pressure rises up to that level. normally we do not start with antihypertensive medication, right? uh, Bed rest, some high protein diet, so that can, and some relaxation that can help you at to keep your blood pressure within normal limits. And there's a big category of women who will be normalized by these simple domiciliary measurements. They will not require even hospitalization. Their blood pressures will not rise, and they may not require any antihypertensive treatment. And this usually happens when hypertension develops during later weeks of pregnancy. Later weeks of pregnancy means around 36 weeks of pregnancy. That if it develops at that time, then it's mild hypertension and more manageable. But if it is early onset hypertension, early onset I would mean around 32 weeks or even earlier than that, then that is one hypertension which is more serious, a little more serious, more associated with complications and consequences both to the mother and the fetus. And this is a category of patients where we need to be more vigilant, right? So if blood pressure begins to shoot beyond 150 by 100 millimeter of mercury by these simple measures, then that is the time to start with antihypertensive treatment. Now you will be surprised that there is a huge spectrum of medicines, antihypertensive medicines, which are available in the market, which are available to any individual. But all these medications are meant for essential hypertension or chronic hypertension or hypertension which happens in a non-pregnant individual. During pregnancy, there are very few medicines which can be used for hypertension during pregnancy. And the reason is not that these will not be effective. The reason is most of these drugs are harmful for the fetus. Their safety for the fetus is not established. So what we are left with? Three drugs. In the past, methyl dopa was one drug which was used for decades and decades. This medicine was used very effectively for management of hypertension in pregnancy. But now we are more towards using another antihypertensive, that is labetalol. So labetalol is one drug which can be used very safely for the management of hypertension during pregnancy. Then another drug is very commonly used for essential hypertension also is nifedipine. But first line drug, the first drug which we need to start, which we prefer to start, will be labetalol. So depending on your levels of blood pressure, the antihypertensive dose can be adjusted: 100 milligram twice daily, 200 milligram twice daily, 300 maximum. So once there is a need to start with the antihypertensive medication, then I usually suggest that patients should get admitted to the hospital for a few days, basically to get all the baseline investigations done, to see any complications are developing, and to to adjust the dose according to the needs of. Okay, sorry for the interruption. There was some interruption. Okay, so we were talking about when you will require an antihypertensive drug, and if antihypertensive drug is required, then that will also be the time when um, admission, hospital admission is required to titrate the doses of the drug to suit your blood pressure, to keep a watch on your condition, general condition, and also for certain investigations, baseline investigations, and then investigations repeatedly. Now, I'm talking only and only about the mother right now. Another most important aspect of this pregnancy is the fetus inside. If the mother is hypertensive, then definitely it is affecting the baby also inside, right? And in what way? In what way? See, with hypertension during pregnancy, the chances of growth restriction of the fetus, That means the growth is not as per the parameters as it should be. It's not there. The nutrition is not going properly. The placentation had not been proper, and hence the nutrition to the fetus is not going properly, and that is why the baby is also affected during this whole process. And this concern becomes even more important in case you are also having proteinuria. That means leakage of proteins in the urine, that will affect the baby even more. So as we are monitoring you, the mother, for the management of hypertension and the complications, at the same time, at every visit, we are also concerned about the health of the fetus as well. What you as a mother can do, you can feel the fetal movements at least, right? You can feel the fetal movements, at least 10 movements in 12 hours, or you can see 3 movements every 4 hours. If that is there, then that is a good fetal activity. That means the baby is not affected. But at any time, if the fetus, if the fetal movements, if the baby cake count is less than 10 in 12 hours, that is of concern. Again, you need to inform your obstetrician about that. In fact, the every obstetrician will inquire you also about this daily fetal movement count. So this is what the mother will feel, the fetal movement count. What we as obstetrician see, we always check what is the progress of the pregnancy. How much is the increase in the size of the uterus? Is that sufficient? Is that satisfactory? If it is not satisfactory, then immediately it comes to our mind to get an ultrasound done. Although routine ultrasounds during pregnancy are also suggested at certain intervals, but in case the growth of the uterus is not sufficient, that can be either because the baby is affected, or the liquor or the water or the fluid around the baby is reduced. Both will indicate consequences of pregnancy induced hypertension. So in that case, an ultrasound will help us a lot to know about the fetal health, the health of the baby in utero, and color Doppler studies help us a lot to know and decide about the weight of the baby inside. NST is also one thing. NST is a trace, an ECG-like trace of a fetal heart and the uterine activity. We can do NST also to know the fetal heart. So both mother and the fetus have to be monitored while we are monitoring you during hypertension. Now supposing you have reached that stage. Any woman who has reached that stage where her blood pressure is not getting controlled with a single medicine. We started with labetalol, and you are still far from your expected date of delivery, and the fetus inside is okay, fetal health is okay, fine, as decided by the ultrasound and the color Doppler. In that case, we and there are no biochemical changes, I mean, the blood parameters, blood test parameters are within normal limits. In that case, we can think of adding one more antihypertensive drug, right? So we started with labetalol, full dose, tried full dose of labetalol, did not help. We can add a second line of drug as well, nifedipine we can start. But remember, if we have reached that stage where we will require two medicines, that means the severity of the disease is of concern. And we will do that only if the fetal maturity is not there, right? And we want to wait for a few hours, say 48 hours, to induce fetal maturity. And there are some more complicating conditions, something more adverse in your blood reports. In that case, that will be the time to terminate your pregnancy. If the baby is not yet mature, you are far from your expected date of delivery, and then we can induce this fetal maturity by giving certain injections, and after 48 hours we can take out the baby. Now, by how do we take out this baby? By cesarean or by normal delivery? And I would emphasize here that hypertension as such is not an indication for cesarean section. Okay? If the doctor has been able to control your hypertension, you are well stable, your blood parameters are okay, your fetal health is okay, the pregnancy can be terminated by inducing labor. But if you are having, if somebody is posing is I mean, during this pregnancy induced hypertension, there is also lots of fluid retention also. So you are swollen. Sometimes why people are very much swollen because of this fluid retention edema, and this fluid retention is too much. The complications are scary. Fetal health is affected. In that case, no, we will not take a chance for a normal labor, because now this is the baby which is already not very healthy inside uterus, will not be able to tolerate the stress of labor, and then in that case we will require to do take out this baby by cesarean section. And in case some women by chance, it's not that only severe hypertension will ultimately lead to seizures. There are instances, or there are incidences where even with lower levels of blood pressure, a woman might throw a fit, might throw a seizure, resulting in eclampsia. Don't get scared. Immediately rush to the hospital. There are medications which are available very effectively, very effectively controlling eclampsia, the seizures, and in that case, immediate termination of pregnancy is must. Now, supposing patient along with seizures also starts getting contractions, and the doctor finds the findings are very favorable for a normal delivery, no harm in delivering normally vaginally, normally, normal delivery, right? Provided the baby inside fetal heart remains stable. Sorry. But but if the fetal health is also not good and mother has thrown a fit and her parameters are deranged, in that case immediate termination of pregnancy by a cesarean section is desirable. So I think this is more than enough regarding pregnancy induced hypertension. I will again emphasize that I am telling all this because not to scare you, but to make you aware of what can be the consequences of hypertension during pregnancy. How is it different from hypertension in a non-pregnant individual? And, the most of all, if it develops, in that case you need to take care of yourself by regularly going to your doctor and following her instructions. See, if you are taking antihypertensive drugs and at home you are at home domiciliary treatment, and you're charting your blood pressure levels, you find your blood pressure is normal and you decide to stop medicine, and my blood pressure is normal, why should I now continue to take antihypertensive? In that scenario, remember, your blood pressure is under control only and only because of this medication. Okay, so never ever stop taking medication whatever has been prescribed to you. As I said in the beginning also, that till date there are only theories about the cause of the disease. We still do not know. Whatever the symptoms patient tells us or we see in the patient, we are treating only those symptoms. If you're hypertensive, we are treating your hypertension. If you have any other complication, we are treating that complication, but we are not targeting that exact cause of hypertension during pregnancy. So remember, if you are treating hypertension, your hypertension as such may be right, but whatever is happening to your body is happening at the same severity. Okay, so be just careful. Anybody, you can disseminate this knowledge to your circles also. You can help your friends or family, somebody who is having hypertension, to make her aware that hypertension during pregnancy is something which is not to be ignored, but just to be taken care of seriously, and following the instructions of the doctor. Immediately you come to us, we'll manage you. And the target, the goal of our treatment is to avoid your complications and to give you a healthy and happy mother, both healthy happy mother and a healthy happy baby, both together. Thank you. Any questions? from the audience. Any questions from the audience? Okay, thank you so much. See you next time.